Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about the causes, diagnosis, and treatment of child onset fluency disorder or stuttering. In this episode, we begin the analysis of social or pragmatic communication disorder in detail, focusing on its nature and symptoms. Nature of social communication disorder. Social communication disorder, SCD, also known as pragmatic communication disorder, is a neurodevelopmental condition, and its symptoms appear very early in a person's development. Unlike some of the communication disorders, social communication disorder or SCD does not consist in difficulties in articulation of words, phonics, or order of words, but rather an individual having problems in communicating socially. Hence, social communication disorder does not impact the affected person's language comprehension, articulation, or expression, and may have no issues with understanding grammar, punctuation, syntax, order of words, or sentence flow. However, they may lack proper social communication and would have trouble understanding and using verbal and non-verbal communication for social purposes. It involves impairments in both verbal and non-verbal messaging, specifically relating to interactions with others in the society. As a result, they have difficulties to share information in a social environment in an appropriate manner. Thus, social communication disorder revolves around two factors: pragmatics and social understanding. First, pragmatics. It refers to using language in the right context. It implies interpreting your surroundings to discern the meaning of the linguistic context. For example, the language is used differently when you are speaking with your best friend, with a stranger, or with your boss. Similarly, they will have difficulties in differentiating between speaking to a child and to an adult. Likewise, they are incapable of changing from a formal conversation to a colloquial one. Inability to recognize the need to change the way you speak with the different people in different social settings or contexts is the pragmatic aspect of social communication disorder. Second, social understanding. It consists in the affected persons having difficulty in following rules of conversation. It also involves inability to understand things that haven't been said explicitly. You struggle to notice subtle parts of conversation or to pick up non-verbal messaging of people during a conversation. You also may find it difficult to keep the flow of conversation and to respond to the thoughts and ideas of others. Social understanding aspect of the social communication disorder can create problems for the affected persons in the following areas of social communication. Firstly, they have difficulties conceptualizing sentences such as metaphors, humors, sayings, maxims, or aphorisms that have implicit, indirect, implied, or non-literal meanings. For instance, they will find it difficult to understand sentences with double meanings, that is, sentences with literal and implicit meanings. Secondly, they find it difficult to understand verbal communication due to lack of understanding of social cues and behaviors, such as not always knowing when or how to greet people, and not knowing when and how to intervene during a conversation. As a result, they often behave in an inappropriate manner, such as greeting people in the wrong way, intervening in conversation at improper time, or speaking with wrong intonation or volume of voice. Thirdly, they have difficulties in comprehending and responding to non-verbal communication, such as gestures, messaging sent through eye contact, and communications through facial expression. Finally, they find it difficult to understand emotional context of a situation. As a result, they have trouble not only to grasp their own emotional state and express their own emotions appropriately, but also have difficulties in understanding others' emotional states and feeling with them. Symptoms of social communication disorder. The symptoms of persons affected by social communication disorder include the following. First, difficulty recognizing when and how to change the tone or styles of communication. For example, inability to speak differently on the playground or in a classroom. Second, trouble sharing information, initiating conversations, greeting people, engaging in conversation, and following the rules of conversation. Third, problems with social greetings, such as saying hello, introducing themselves, or asking people how they are doing. Fourth, constantly interrupting and struggling to adhere to conversation etiquette, such as providing more details, taking turns in conversation, staying on the topic, and interpreting verbal and non-verbal cues. Fifth, finding it difficult to grasp implied communication, such as humor, idioms, sarcasm, metaphors, puns, and the like. Sixth, having poor eye contact with people while conversing. Seventh, difficulty in expressing one's own emotions and understanding the feelings of others. Eighth, inability to adjust communication to match the context or the needs of the listener. Ninth, inability to respond to people appropriately. For example, a person with social communication disorder may give unexpected or slightly off the mark answers. 10th, inability to apply the known communication and language skills in the context of social situations. Consequences of social communication disorder. The presence of the above mentioned symptoms of social communication disorder in people would cause them to struggle with changing their communication style to fit different scenarios. Though they may develop a vocabulary, understand grammar, and individual words, they may find difficulty with the pragmatics of language, impacting their speaking, writing, gestures, or use of sign language. Besides, social communication disorder can have long-term consequences impacting the affected person's daily life, both at school and at work, and their ability to keep, maintain, and participate in personal and professional relationships. In the next episode, we will speak about the causes, diagnosis, and treatment of social communication disorder. Thank you for watching this video. Stay blessed until we see you again with another video.